Hey everybody, this is Dr. Hinson. I was going to make a video real quick because I wanted to talk a little bit about ACL injuries, especially the ACL injuries that occur from a non-traumatic cause, meaning someone with, like in football, a helmet being pushed into the knee or some other player falling on top of the knee. I'm talking about the type of ACL injuries that are the athlete's just running down the field and his knee gives way, those type of ACL issues. And so I do this because one of my favorite players, Deshaun Watson of the Houston Texans, suffered something similar last week. And it's so frustrating because in applied kinesiology we use a lot of manual muscle testing, meaning we evaluate a patient's muscle function in a variety of different ways. The type of muscle weaknesses or muscle dysfunction that we find is often not due to a lack of exercise. And many of these muscle weaknesses cannot be corrected with exercise. They are malfunctioning because of a brain muscle or a nerve muscle issue, meaning the brain and that muscle or the nerve and that particular muscle are not communicating very effectively. Okay, sorry about that. We had a phone call. The muscle weaknesses that we find have to be evaluated using applied kinesiology methods or some other form of manual muscle testing to discover why they are malfunctioning. I mean, a good case in point is when a person's quadriceps muscles are activating, right? Their hamstrings have to let go so that the leg can fully extend, and then the opposite's true as well. Let's say if my bicep muscle, if I'm going to curl my bicep up, my tricep on the back of my arm has to let go so that my arm can come up, right? So there's all these little muscles imbalances, and basically the point I'm trying to get to is injuries that occur that way to athletes could very well have been corrected and identified before the injury ever took place, saving them months of rehabilitation. And so these muscle weaknesses we don't necessarily feel. We won't know that they're there because the body does such a great job of compensating and adapting, which is what we want it to do. And so if you are an athlete, or even if you're just an everyday person like me and think you're an athlete still in your head but you're not, then find someone who does applied kinesiology or someone who does systems healthcare, quantum neurology, someone who can evaluate the muscle function, the nerve function of your body, and especially if you want to improve your performance and avoid injury, because so many people are suffering with injuries that are occurred from non-contact, and it's just so frustrating. And I really believe that someone like a Deshaun Watson, that the muscles that stabilize the knee and prevent ACL injuries, those weaknesses could have been found and corrected, saving his season, as well as saving the organization, time lost from him being able to play. So anyway, if you have any additional questions or anything like that, comment below and I'll do my very best to answer any of your questions. But anyway, hope you guys are having a great day. Talk to you later.